Hi, hello everyone. This is Dr. Nidin. Welcome to another episode in the Health Talk with Dr. Ashutosh from Healthcare Homeopathy. And today we'll be talking about rheumatoid arthritis. So, rheumatoid arthritis is like we heard this term very often. We have like especially we have heard it from various doctors talking about rheumatoid arthritis. So it's a very common condition. It's a autoimmune inflammatory disease, which usually causes lots of pain in various parts of the body, along with few other symptoms. So we'll be talking about this condition in more detail with Dr. Ashutosh. Hi, Dr. Ashutosh. Welcome to this episode. We
Hello.
would like
Yeah.
to, yeah, we would like to understand about rheumatoid arthritis. So, can you tell us what is this rheumatoid arthritis?
So rheumatoid arthritis is basically a autoimmune disease. Autoimmune means our body has a defense system that is called as immune system. Here in autoimmune disease, what happens? Our body immune system start to destroy our own healthy blood cells or joint cells. In here, in case of rheumatoid arthritis, it start destructing our own joint lining that is called synovium, which causes inflammatory changes. Inflammatory changes means pain, swelling, then redness. All those things will come after the inflammation starts. So in rheumatoid arthritis, what happens? The inflammation leads to the destruction of the joints space, then cartilage, then bone cells, and completely joint structure will be damaged. So in rheumatoid arthritis, if it is left untreated, it can lead to permanent disability and deformity. Joint, this one will be lost. So these are the changes we see in rheumatoid arthritic cases. So this is rheumatoid arthritis. It's basically an autoimmune disease.
Okay, okay. Thank you, doctor, for clarifying this. Like, can you guide us, like, what are the common causes of rheumatoid arthritis? Why people are getting rheumatoid arthritis?
So actually, till now there is no certain cause for rheumatoid arthritis. What is the main cause for rheumatoid arthritis? But there are some theories, or this one is there. I can tell you, like some people might get have more chance of getting rheumatoid arthritis. It is mainly related to genes. Some genes are predisposing someone to get rheumatoid arthritis. So this is one cause. Then another cause will be patient is having family history. Anybody is their family is having that rheumatoid arthritis or any kind of autoimmune related diseases, then they will be getting more chance of getting rheumatoid arthritis. If patient is obese, if patient is having severe stress, if patient is having continuous exposure to certain chemicals, like he's like working in a factory or somewhere there is silica, asbestos exposures are there, then it is more common. And females are also more prone compared to male, 2 to 3 times they are more chances to get the disease in females. So, and if patient is having smoking history, that is also very common in patient who is doing like this kind of thing. So there are varieties of facts so which can predispose someone to rheumatoid arthritis, but no sure short cause of rheumatoid arthritis till date. Yes.
Okay. So like the pain is pain in the joints. I think it's a very common condition or symptom that occurs in various condition. So how do you think like the patient will get some idea or some hint about rheumatoid arthritis and how he can understand or say that he is having some symptoms of rheumatoid arthritis. So can you put some light on the symptoms of rheumatoid arthritis?
We have to differentiate. You have raised the valid point actually. How do we differentiate with rheumatoid arthritis with other kind of arthritis? So I will just differentiate how can we just evaluate the rheumatoid arthritic cases, because rheumatoid arthritis is diagnosed with variety of factors. Some are like diagnostic tests, some are like signs and symptoms, some are like X-ray finding. So I will brief it out everything. So in rheumatoid arthritis, first we will go for clinical examination, clinical signs and symptoms. So in rheumatoid arthritis, you will be having pain of joints, and joints will be like 3 to 4 joints. If it is more than 6 weeks, these are the criteria. Based upon that, we diagnose the case of rheumatoid arthritis. 6 weeks or more, if the patient is having joint pain, then there will be early morning stiffness will be there. That will be lasting for 1 hour, 1 hour after rising from bed. Common in rheumatoid arthritis. Then the patient is having, if we do X-ray also, we will find some joint erosions will be there in rheumatoid arthritic cases. Then there will be higher level of CRP blood test. If we do, high level of CRP will be there. CRP means it is a response of body against inflammation. Means inflammation is high in the body. It will indicate. Then in patients of rheumatoid arthritis, there are some factors like rheumatoid factors. That is positive. That is an antibody. Rheumatoid factor is an antibody which develops in rheumatoid arthritic cases. Not every case it is common, but it is found in only 50 to 60% of cases. The rheumatoid factors are common. Another test like anti-nuclear antibody, that is also a source of inflammation is there. It will be raised. ESR will also be high. Then a test called anti-CCP test. Anti-CCP test will be positive in some case of severe form of rheumatoid arthritis. We call it a seropositive rheumatoid arthritis. That is also very common. So these are the tests. And one more thing in rheumatoid arthritis, first it will affect the small joints like hands, fingers, wrist of hands and feet. Then and the environment will be symmetrical. Like one side of body is having pain in one joint, like fingers, wrist, elbow. Then another side of body is also having the similar kind of pain. So symmetrical pattern, multiple joint involvement. Okay, a formation of rheumatoid nodules will be there. Is a hard cystic swelling will be there under the skin near the joints, especially like finger, then elbow, knuckles. So these are the common things we differentiate with rheumatoid arthritis with other joint pains. And the morning stiffness is classical symptom of rheumatoid arthritis. So these are the things we can differentiate with other joint pain. Yes.
Okay, great. So, say some patient comes to you with say symptoms indicative of rheumatoid arthritis. So, what kind of test or investigations do you do to diagnose these conditions?
As I said you that rheumatoid arthritis is a combination. We diagnose with the combination of clinical findings along with the X-ray findings and the blood test. So, like symptom-wise, also we'll see if it is a stiffness is there, small joint involvement will be there, and if patient is having more than 6 weeks of multiple joint pain, swelling will be there, redness will be there. Okay, and feel some in flare-up cases, it becomes redness and heat also in some cases. So these are the clinical signs and symptoms. Stiffness will be there. Diagnosis part, then we will do investigation. As I said, CBC will do. Then we will do RF factor. We will do anti-CCP test, ESR test. If everything is co-indicating and collaborating with some single point, that it is indicative of rheumatoid arthritis according to our criteria. And if we do like X-ray also, there will be definitely joint erosion will be there, loss of joint structure will be there. That is also confirmatory of rheumatoid arthritis. And in advanced cases, if you go, you will come to know that patient is unable to move their joints and hand joints or elbow joints because there is a fusion of bones because of joint structure is lost. Then two bones will be fused with each other. So there will be flexion, no flexion will be there, no abduction will be there, no extension will be there. So these are the all combined. We will diagnose a case of rheumatoid arthritis.
Okay. So you meant to say whenever the patient will come or visit your clinic, they will have to undergo as a doctor, you will examine the patients and also you will suggest some test just to confirm the diagnosis.
Just to confirm, yes, just to
Yeah.
confirm.
Yeah. Okay. So, like even the patient may, like in some cases, they might get diagnosed, but some patient tends to delay the treatment, or even some patient might like ignore the symptoms and they don't start the treatment. So usually in like most of the cases, it happens that there could be some possible complications of the diseases. So can you tell us what are the complications in case of rheumatoid arthritis if it is not treated regularly or on the time? What could be the possible complications in the patients?
This complication again, I will divide into two parts. One complication which is related to joints, and one complication in body as a whole. I will tell. So in joints, what happens? As I said, if joint structure is lost, there are joints means they one place where two bones fuse with each other, joint with each other. That is the joint space. In rheumatoid arthritis, that whole joint structure will be lost in advanced cases. So there will be fusion of two bones. When the two bone fuses, then there will be no mobility of joints will be lost, no extension, no flexion. So flexion extension means how we will extend our elbow, knees, shoulder, all will be lost. And patient will be bedridden also. They will not do their daily activity of flexion, extension, rotation. Those will be lost. And if it is untreated, patient may be bedridden also. They can't do their work properly. It will lead to permanent deformity, disability. And deformity also happens in case like rheumatoid arthritis. Some patient will use strong neck deformity and some Bertonick's deformity. Then there is ulnar derivations, common rheumatoid arthritic complication for deformity of rheumatoid arthritis. So we can prevent this rheumatoid arthritic deformity if early diagnosis is made and early treatment is made. Then there will be some this one like systematic, like if you see as a body as whole, patient of rheumatoid arthritis may have symptoms of weakness, lethargy, then loss of appetite, then there will be weight loss, fever will be there, then depression, stress, and anemia also in some cases we see. And apart from that, it affects the vital organ also, like eyes. If eyes is affected with rheumatoid arthritis, then eye dryness will be there. Scleritis, that is inflammation of sclera of eye. Then there will be cataract in some cases. In if you compare lungs, in lungs it will lead to inflammation of lung tissue, fibrosis. Then in case of kidney, there is amyloidosis, one condition called amyloidosis means there is a protein called amyloid. It is get accumulated in one place. It is called amyloidosis. Then in heart, there will be inflammation of heart, that like pericarditis will be there. Lining of the heart muscle is called the pericardium. It is that inflammation is called pericarditis. Then inflammation of muscle tissue of heart, myocarditis, and in some cases it will lead to destruction of the blood supply to heart muscles like angiography, coronary artery disease in some cases. If it is affecting the muscle, this one nerves, we call it as peripheral neuropathy. Then other carpal tunnel syndrome. So the effect is like huge if it is untreated, if it is not properly managed. From because it's a systematic disease, a whole body gets affected unless and until it is not treated well.
Okay. So what I can summarize is, doctor, that majorly it affects the joint mobility and flexibility. But apart from joint, it also have effect on other parts of the body, and it can, in some cases, it can create lots of complications. So that's why we need to treat the rheumatoid arthritis on time before the complications are getting severe. So, doctor, I'm sure there must be some ways how we can prevent these complications and rather the rheumatoid arthritis itself. So, do you have any suggestions how we can prevent these complications?
Like I said, that rheumatoid arthritis is a known cause of rheumatoid arthritis is not known actually, but there are certain predisposing factors which can lead to rheumatoid arthritis. Like if somebody is having a positive gene family history, they will be getting more chances of getting the rheumatoid arthritis. So they can do certain kind of lifestyle. If they're smoking, they can quit smoking. If they are doing a sedentary work habit of sitting a place and not doing any activities and do some activities like walking, jogging, doing some exercises. If patient is obesity, they can reduce weight, and patient who is having like more of this kind of thing, smoking, all those things can be avoided. If having more continuous stress, they can do some de-stressing activity because stress is also a common cause nowadays. So these are the things which is a preventive measure, but it's not sure that it will be not lead to rheumatoid arthritis. But if somebody is having family history of rheumatoid arthritis, they are more prone to develop. So if they are doing this kind of thing, they can avoid doing like this activity, and they can do some healthy lifestyle as I mentioned earlier, so that they can be prevented to some extent. Yes.
Okay, okay, great. So, doctor, say some patient you might have already treating some of the patients for rheumatoid arthritis. So, how do you approach for these patients for treating their condition? So what all treatment options do you provide?
So in healthcare homeopathy, we give as a homeopathic doctor. So we give homeopathic treatment to our patients. So rheumatoid arthritis, as I said, it is a multiple disease, multiple body structure disorder. Like if it affects the joint, then it will lead to all the other organs, vital organs of the body. So approach should also be constitutional only. It should not be one body parts we are treating, other body parts we are avoiding. So as a whole, we should treat the patient. And our homeopathic medicines work very well in case of if patients are coming very early. The prognosis means the outcome will be very good. If they are having symptoms of swelling, joint pain, early morning stiffness, they respond very nicely to the homeopathic medicines in healthcare homeopathy. Along with that, if they are having some rheumatoid arthritis, as I said, as the age advances, it progresses to other complication, as I mentioned earlier. We can halt the process of progress. We can stop the process of complications of rheumatoid arthritis, so that person can lead a good and healthy life. If all patients are coming with permanent disability, permanent defaulty, in that case, the reversing is not possible. But we can anyhow manage the lifestyle of the patient with homeopathic medicines. Then if patient, that is what we suggest actually, as early as patient comes, the destruction of joints and the permanent disability can be avoided. So we suggest patient to come as early as possible. Then with homeopathy, we give medicines which are suitable for any age group. Like if some patients are juvenile that is also common. Some age patients are also common. So our homeopathic medicines are suitable for every age group, be it be young patient, be it be young kids, old patients. There are no other side effects, and equally they are getting effect of our medicines. And along with the homeopathic medicines, we give certain customized diet chart to each and every patient, or how what they should eat, what they should avoid to each and every patient as per their symptoms and sign and disease progress. Then avoid lifestyle modification, doing some de-stressing activity. Another thing we should do and don'ts in rheumatoid arthritis. Then we will give some exercise, how what they can do exercise in rheumatoid arthritis to keep their joints healthy. So along with medicines, our approach is to cure the patient as a whole in healthcare method. So this is our approach in rheumatoid arthritis cases.
That's very interesting, Dr. Ashutosh. I see that you are using combination of various modalities which are going to help for improving the symptoms and also reducing or without any side effects. So that's surely somebody should try this approach. And if you are somebody from Davanagere, you should definitely visit Dr. Ashutosh clinic, that is healthcare homeopathic, and you should definitely get some consultations, even if you are newly diagnosed, or if you feel that you have some symptoms which we talked some time back, so that you will get that guidance from Dr. Ashutosh. And if it
Yeah,
is
in
very
rheumatoid
early.
arthritis, that is what I suggest is as early they come as good, because if it is progress, it will be a little bit difficult to reverse those deformity and disability.
Okay, great. Surely, doctor. So thank you very much, doctor, for providing your guidance. And I'm sure that if you are listening to this short guide on rheumatoid arthritis, it should help you and it should guide you, and it will give you some clarity about if you are already suffering from this condition. So I request you again, like if you want to get more details about rheumatoid arthritis, please do visit Healthcare Homeopathy Clinic if you're from Davangere or nearby Davangere. So that's all for today's topic. In next episode, we'll meet again with Dr. Ashutosh with some another condition. And till then, please do visit this channel. That's all for today. Thank you. Bye bye.